Over the past few days, China has reported an increase in human metapneumovirus cases, a respiratory virus that causes flu-like or cold-like symptoms. The outbreak has raised concerns among some members of the public, especially given the memory of the dark days of COVID-19 pandemic, which brought about strict measures like lockdowns and travel bans. According to the Uganda Virus Research Institute, human metapneumovirus was discovered in the Netherlands in 2001 and is not a new virus. In Uganda, cases of the virus were previously detected in 2013, suggesting some level of existing immunity in the population due to past exposures.
One of the studies we did in 2013, we found that among those who come to our centers with such illnesses, about 1.5% had this virus. It's one of those causes of cold, cough, flu. When it gets serious, you get pneumonia.
Over 20 years, we don't have evidence whether it has significantly changed, but runs a seasonal course in China, and China has been always able to control it, much as the spikes come, specifically during the cold season.
Addressing concerns about potential risks posed by travel between Uganda and China for business and other purposes, Ministry of Health says that the current situation does not warrant panic and there is no need to worry.
We know what is going on. We need to watch. If there's anything to worry about, we're going to inform people. But I want to really allay the fear among people. It's unlikely this will be like COVID. COVID was a new infection. We didn't have any immunity to this new virus, but this is not the case. This is a virus that has existed, but it has increased in some populations. So we are going to watch out.
According to the Ministry of Health, there are no plans to impose travel restrictions, but advise travelers to affected areas in China to take necessary precautions.
No, we don't talk about any lockdown. Not even in the immediate. For travelers who travel to some of these places, we have to appreciate the symptoms, possibly take these measures and ensure that you don't get exposed. We don't have any recommendations for travel restrictions yet, as of now.
I don't think you should worry people for now, scare them from traveling to China or Japan or India. In the case with this, because one of the ways of seeing that there's a problem is when you see a surge, an increase in infections in children, pneumonia. Sometimes they affect those who have asthma and the rest. You start detecting those, then it gives us some suspicion and we start testing. I think for now, we should remain calm and just watch the situation.
The routine surveillance will continue, but Uganda Virus Research Institute says attention has to be drawn to the fact that viruses can mutate.
Of course, more needs to be done because, as you know, viruses change, they mutate. So those who are doing the sequencing of the virus to look at it, they will have to check, has it changed a bit to become more transmissible and cause more severe disease. Those are all the things that now needs to be done for the scientists to look at it. Is it the same virus or has it changed a bit?
Unlike 5 years ago during the onset of COVID-19, Ministry of Health officials say that Uganda is better prepared to handle any potential outbreaks.
The detection capacity is much higher, is much faster. The response mechanisms remain. That is on detection, but also in terms of care component. The health workers, we have a bigger pool of health workers who are trained and who can be able to manage patients.
Norbert Atkunda, NTV Tonight.